This evening we're conducting it via Zoom, reminding everyone that the meeting is recorded via Facebook, and we will ask speakers to identify themselves. At the moment, I'm just going to ask the members of the board to identify themselves. I am John Jeffries. Bob?
Bob Springett here.
Robin?
Robin Hunter.
Thank you. We're going to open this evening with citizens' comments. Kate, any citizens who've asked for time for comments?
John, there's been no emails to me about public comment, but I believe there are people present here that have public comment.
Okay, so Kate, for public comment with regards to the mask mandate, what I'd like to do, and Bob and Robin, please feel free to weigh in on this. I'd like to ask people, if their comments are regarding the mask mandate, that they hold the questions until after the Board of Health has presented. I think that way we would get a feel for where the Board of Health is, and with regards to mask mandates, be able to answer questions specifically in order as they pertain to the mandate. I say that and I ask that to Robin and Bob, because I've heard from constituents of ours who have asked me specifically to ask questions, specific questions to the Board of Health regarding the mask mandate. So Robin, Bob, how do you feel about that as a procedural matter?
I don't have an issue with that. I think, you know, as we're all aware, we received many emails regarding today's meeting, especially only regarding this topic. And, you know, I think there might be a little bit of confusion with the citizens of Dover, and I'm hoping not. And I think you had brought this up, John, and I was hoping you would mention it in your opening remarks. But as we are all aware, it is not the Board of Selectmen's jurisdiction to determine whether or not there's a mask mandate in town. It is the Board of Health. They are the policymakers. They are the ones that make the decision. And I think having the Board of Health on this meeting has led to some confusion. I think the purpose of us asking the Board of Health to attend was just to get an update. But unfortunately, I think there are citizens in the town that believe we can somehow overturn policy that's been set by the Board of Health, who are the professionals in this area. You know, we're certainly not. So I am interested to hear, you know, what the Board of Health has to say with regard to the mask mandate, but that's it. You know, they're the ones that set policy for the town.
Thank you. And Robin, to in a sense, you're exactly right. My intent was to begin by framing the question, by framing the first agenda item, just as you described, as it's a Board of Health and not Board of Selectmen. And by doing that, I had hoped, just as you pointed out, to be able to properly frame it in the context of how the Board of Selectmen views this, and also to allow the Board of Health to explain, in essence, that, and maybe answer a lot of these questions in the process. Bob, how are you on this?
So from a procedural point of view, I think it makes sense, and I'll echo Robin's comments in the sense, we invited the Board of Health to come to the meeting to provide an update. It's pretty, it's very much straightforward. We have received a great deal of email comments over the last week or so, maybe 2 weeks. And the other thing I would like the Board of Health to address is there seems to be a great deal of confusion and a great deal of commentary, particularly about mask mandates at schools. And it's my understanding that mask mandates at schools comes from the Department of Elementary and Secondary Education at the state level. It does not come from the local boards of health of Dover or Sherburne. That needs to be clear. And then the second part that I think I've also seen raised, and Jerry can probably help me out here. His arm is going to get tired, so we have to call on him pretty soon. There's also commentary about that if the local population has a vaccination rate in excess of 80%, mandates, you're allowed to reduce mandates. My understanding of that is the 80% number of vaccinations applies to the student population, not the town population. And if that's right, obviously the student population can't have an 80% vaccination rate, since the vaccination for 5 to 12 it's just been approved. So I would like Jerry and Kay and Steve to make sure that we will clarify what roles and responsibilities are, and between the local board of health and the state, particularly as it comes to schools, and to clear up any areas that seem to of misinformation that seems to be rampant in some of the notes that certainly I have seen. So that's it for me, John. We're good to go.
Okay. Thanks, Bob. Thanks, Robin. So, Jerry, before you answer the question or before you make a comment, please allow me just to frame this. I'll turn it over to you in 30 seconds. Then you can make the comment and begin the presentation, whether it's you, Dr. Peterson, or Dr. Kruskal. So just as I don't want to belabor the point, I just want to simply frame it as this is the Board of Health report to the Board of Selectmen. The mask mandate is a specific mandate from the Board of Health. Jerry, while you're shaking your head, no.
Because you skipped the agenda, sir, and I was here for citizens' comments, which I emailed to both Mona and Kate twice today.
Okay. So, Jerry, for citizens' comments, why don't you make the citizen comment, then I will finish and introduce Kay and Steve and yourself. Go ahead.
Okay, my comments have nothing to do with what you've discussed. They are general citizen comments, and they'll be very quick. First, the Board of Health wishes to thank the following individuals for their valuable assistance in the operation of the October 5th influenza vaccination clinic. As has been stated elsewhere, some 467 individuals received the flu vaccine. Most happily, many parents brought their young children who were able to remain in their cars and even car seats and be vaccinated. The Board of Health has received many positive comments, thanks specifically to Elizabeth Rosa, Sierra Bright, Greg Cahoon, Chief Peter McGowan, and most particularly to Bob Tosi and the Highway Department, without whose efforts the clinics would not have been possible. Secondly, per the request and demand of Representative Denise Garlick, the chair did present testimony on several filed bills that addressed, first, the need for imposing on the DEP the obligation to enforce its own regulations. The requirement that a PWS, public water supply, create, maintain, and publish an emergency preparedness plan, and that a PWS reimburse customers for certain costs incurred during a water distribution interruption. And secondarily, on enhancing the language relative to restrictions on outdoor irrigation during a declared drought. Those were the bills on which I was required to testify. Number three, the board did review prior history and determined that there is no, nor even ever has been, an overall restriction on a resident applying for a potable well, even when a public water supply source is available, subject to certain conditions primarily related to lot size and Title V conditions. And lastly, regarding colonial water, capacity, expansion, and contamination. Two separate reports were supplied to the Board of Appeals, in each case prior to the respective Tata and Howard reports. and the information presented in the reports by us was substantiated by the subsequent Tata and Howard reports. Additionally, the second report urged consideration of the negative impact on Trout Brook groundwater supplies, including town-owned lands and lands owned by the Army Corps of Engineers, Department of Agriculture, Dover Land Conservation Trust, and Dover Conservation, if the Tata and Howard mention of increasing the Knollwood well pumping was put into effect. The two papers are in the public domain. Thank you.
Thank you, Jerry. Dr. Kate Peterson from the Board of Health is going to give us a status on the mask mandate currently in place. Dr. Peterson? You're muted.
Thank you for inviting me to come and talk to you about the status of COVID in our area, in our town and our region. And I will remember to address Bob's particular questions about the schools at the end. Remind me if I don't get to it, Bob, but they're very important questions. So I'm going to talk about what the case numbers are like locally and regionally, and I'm going also to speak about the criteria that the Board of Health uses for evaluating the need for a mask mandate. And then I'll talk a bit about the schools, and I'll talk about about masking guidance at this time, and what the Board of Health thinks is important. I have a few slides that I'm going to share, and Kate, you could start with the first one, please. The first is a graph of cases in Massachusetts since the beginning of the pandemic through November 2nd.
It's a work in progress right now, Kay.
That's right. That's right.
Sorry, just 1 second.
Sorry. So you can see on the right the most recent surge that we're still in, but you can see that we're clearly on the descending limb of that surge, which is heartening to see. And the current case rate is about half of what it was at the peak of this surge, which was in late September. This is the Delta surge that started in July and really took off very quickly. The next graph, go ahead, Kate, shows case counts in Massachusetts over the past 90 days. And though it kind of looks like we are in a plateau, that case rate is slowly falling. And the next slide shows how in tabular form, how those numbers have changed over the past 14 days. So this is as of yesterday, the number of cases had dropped 9% over the past 14 days. The number of people hospitalized had dropped 8%. And the number of deaths, though this number is up a tiny bit, basically over the past few weeks, the number of deaths has declined also by about 50%. The deaths, of course, lag the cases. So I'm now going to talk about the way that the Board of Health assesses the need for a mask mandate. I'm going to talk about the CDC thresholds that are described in the next slide. Go ahead, Kate, and show that. So the CDC has something it calls the county level of community transmission, and it defines two parameters that are important. One is the total number of new cases. The CDC defines it as the number of new cases over the past week per 100,000 residents. And of course, Massachusetts does it slightly differently. Massachusetts looks at, it reports average daily new cases per 100,000 residents. So I'll talk in a minute about how we converted from one metric to the other. The other parameter that the CDC discusses as important is the percent of tests that are positive in a county over the past 7 days. And the CDC's criteria are that if either of these is above a certain level, then they consider a community as having sustained or substantial or high transmission rates. Kate, you could go ahead and switch to the next slide, please. Well, clearly the graphics are wanting a bit, but the important number is that when you look at average daily new cases in a community, the threshold of about 7 cases per day indicates or defines the difference between an area of moderate transmission and substantial transmission. So our Board of Health has decided that it makes sense to institute and maintain measures to try to prevent spread when we are having substantial or high transmission in our region. The next slide shows how what our numbers have been like, and what's very, and I've tried to color code the numbers to be consistent with the definitions of high or sustained transmission. So the red and the orange are the higher levels that we have been experiencing recently. The first column is Dover, the second is the combined Dover and Sherburne data, and the third is Norfolk County. But I hope you're all seeing the bottom row, which shows that the report that just came out about an hour ago shows that the average daily rate per 100,000 in Dover and Sherburne has dropped precipitously. It's very exciting news to see. There hasn't been an equivalent fall in the county, but certainly the county rate is falling. So go ahead and advance to the next, please, Kate. And this presents that data, those data in graphical form. This is Matt Vitale's graph that some of you will receive later today or may have already received in your emails, but this shows that lovely descent of the curve in the report that's this week. So the criteria that the Board of Health uses for deciding whether to continue the mask mandate or not is related to this number, is very closely tied to this number. We want to see a number in this range that is in a low or moderate transmission range for at least two reporting periods, each reporting period being, the reporting periods being a week apart. And we also want to see that there's no unusual evidence of community transmission in settings such as the schools or childcare centers. But we are cautiously optimistic that this is a significant trend and not just a quirk. And we are hopeful that if next week the rates are also in a range that indicates lower moderate transmission, that we'll be able to rescind our mask mandate. I guess I'll ask at this point whether there are any questions about the way that we assess the need for a mandate. And then I'll go on to talk about a couple of other things.
So, Kay, with regards to just the data that you're presenting, you receive it on Thursday. You just mentioned you're going to wait for another week before you would take any action on the current mandate. Is that correct?
That's correct.
Okay, that's my only question. Robin, Bob?
So Kate, I don't have, I get, as you know, I get all this stuff from Matt, so I'm pretty familiar with this stuff. I don't have any questions about this per se, but I do have some questions for you, wearing my no longer viable COVID-19 task force about things that I would like to talk about, you guys talk about the way of presenting information to the town as reflecting sort of post-vaccination status. But I'll handle that either later today or we could do it some other time if it doesn't work.
Why don't we talk about that at the end of this presentation if you feel we have time? I don't have too much more to say, but I want to get to a couple of other things and then feel free to.
Okay, great, thanks.
Okay. So
I don't want to be signed up.
shall I continue?
No.
Yes, please.
Okay. So I also wanted to just say a little bit about mask guidance. And Kate, if you could move to the next slide, please. So this is information about the CDC's current mask guidance, which, by the way, does not align with the Mass DPH. Mass DPH doesn't align with the CDC. But what the CDC recommends and what our board concurs with is that in areas of high or substantial transmission, everyone should wear a mask in public indoor settings. That in areas of moderate or low transmission, unvaccinated people should wear a mask in public indoor settings. And I would add that people who are at particular risk of complications of COVID should also wear masks in public indoor settings, even when transmission rates are low. So, and that's my last slide. I would like to talk about the school mask mandate. Bob had some questions that I think are very important. I'd like to explain the way the relationship of DESE and the school administration and the local boards of health. So DESE has a policy that if a school building, not necessarily an entire school system, but if an individual school building has a vaccination rate of greater than 80%, then the school is allowed to seek an exemption from DESE that would enable it to rescind its mask mandate if it wanted to. It's not required to rescind its mask mandate. DESE doesn't have control of that decision, except that if a school building has a vaccination rate lower than 80%, DESE's not going to allow it at this time. So in our school system, the local boards of health have said that they favor a mandated masking in the schools, and the school administration has concurs with that and has instituted a mask mandate in all the schools. The acting superintendent, Kathleen Smith, has submitted a waiver form to DESE for Dover for the high school because the high school vaccination rate is much higher than 80%. It's well above 90% at this point. With the idea that once the boards of health in Sherburne and Dover are comfortable with rescinding the mask mandate in the high school, that they would do so. So I have not heard yet whether DESE has accepted the Dover request for exemption, but if they haven't ruled on it yet, I'm sure they will soon. I didn't see Dover listed in a piece in the, I think it was the patch about schools that have received exemptions. The combined boards of health will be meeting on Wednesday to talk about masking in the schools and also municipal masking and what the latest numbers show. So I think that's everything. I just I'm sure I'm not expressing how excited I am about the numbers that came out today, but they are really great, and I think we should all applaud ourselves for having done so much to bring things down in our town and in Sherburne as well. It's of note that there haven't been any instances of school spread of COVID, despite the fact that there have been a number of cases in the schools, and that's really phenomenal. It suggests that our strategies are working very well. So any questions?
Kate, okay, I have 3 questions that came to me via text, and I'm going to take one because it speaks directly to what you just said. And specifically, this is from a constituent who just writes to me via text. On Bloomberg this morning, there was a doctor from Johns Hopkins Bloomberg School of Medicine speaking specifically on the topic of children and masking. They were asked specifically regarding a COVID positive test that shut down Disney in Taiwan. And there was essentially, the essence of this is the professor from Johns Hopkins was asked specifically about the logic or the necessity of masking children in school. And his comment was, the masking of children is not logical nor necessary. So I think that may speak because children are not seen as spreading this. So I think that speaks directly to what you just said. And I don't know if that can be inferred as this person is asking, if there's no spread in the school and there's no spread amongst children, why are we masking kids in the first place? So I'm just, that's my interpretation of the question, and I apologize if I didn't get it correct, but I believe that's what they're asking.
So first of all, kids spread COVID to each other and to their parents and other caregivers very easily. So that's misinformation that you have, that the idea that kids don't spread it. The reason they're not spreading it in our schools is that they're wearing masks. Masks work. And in school systems, there are many examples of this, but in school systems that have not used masks during surges with kids, there have been many, many secondary cases in schools that have necessitated closing classrooms, keeping kids out of school for isolation and quarantine periods, and even on some occasions, closing entire schools for short periods of time. So there's a lot less disruption of schooling with masking in schools, particularly when we're in periods of high transmission.
Thank you. The second question is, there was no mask mandate between April and August when the case level was about where it is right now based upon your screen. If cases were few, the cases were few and far between. As kids came back from the summer, cases spiked and then dropped as fast as they spiked. Why is there a mask mandate when we have so few cases?
What's important is the number of cases adjusted for the population, and we haven't had, we have, it's the difference, well, if you just look at absolute numbers and you don't adjust for the size of our population, you could say, well, we don't have that many cases. What's 7 cases? I mean, you think about Boston, it may have hundreds of cases, but we have a small population. So it's important to look at the number of cases adjusted for population size. And we use the metric of cases per 100,000 residents. And our case rates were not low during this most recent surge, and they were rising very rapidly. So we needed to do something. when you have rising case rates, if you do nothing, they continue to rise and they rise ever more rapidly because there's no control method. But if you start to institute controls, you can slow down the rate of rise and eventually reach a peak and then start to see a decline in rates. And that's what's happened. And it's not just masking that has brought this on. It's testing, it's isolation and quarantine, it's contact tracing, it's social distancing, it's all the things that we have struggled with over many months now.
Thank you. So just want to make a clarification on a couple of things that are happening simultaneously. Dr. Peterson, while you were speaking and while I was asking questions of you, I'm trying to monitor the chat, I'm trying to monitor text, I'm trying to monitor email, all simultaneously. And I just want to speak to a couple of the questions in the chat box. We will get to the questions in the chat room right now via Kate. Kate is monitoring the chat. I've been trying to monitor text and email, and trying to do at least 3 things at the same time simultaneously is not easy. So I assure everyone on the chat box inside of the Zoom protocol, we are going to get to your questions. There are people who were not able to log into the Zoom. I believe Justine might be one of them, and thus have sent text direct. So without belaboring any of that, I'm going to move to Robin. Do you have questions, comments that you would like to ask either Dr. Peterson, Dr. Kruskal, or Jerry?
So I would like to discuss the format of this meeting, because if you're reading texts that people got, we should not ignore the 20 odd emails that we got from individuals during the week. I think a majority of them, there was only one that I recall that had issues with the mask mandate, but a majority of the emails that we got were in support of the mask mandate and thankful to the Board of Health for looking at the data and protecting the community as a whole. So I think it's important to mention that, the support that we got, or that the Board of Health got, in many emails that we received from citizens of Dover. And there was also one email from a citizen of Dover that's questioning the mask mandate. I thank the Board of Health for going over the criteria that they've used for the mandate, but again, it's not for us to debate with them. They are the policymakers in this area.
Is that a comment or a question?
It's a comment. They're the ones setting the policy, and so I thought this evening was for them to just come in and provide us with an update, and not to debate the merits of their policy. They have their own meetings, and at their meetings they discuss whether or not to keep the policy in place, and they look at the criteria that they're using to make those decisions.
Correct.
So, is that the purpose of this agenda item, for us to once again debate the merits of that, or just simply to get
no,
an
I
update?
don't think it's a matter of debate. I think it's a matter of allowing this to be a platform to people to ask questions. As I said, I'm trying to monitor the chat, which Kate is doing simultaneously. I think Kate has addressed this very clearly and specifically, that we would allow questions as I framed at the very beginning of the topic. So I don't think it's a matter of debate. I think it's a matter of answering people's questions in a public forum. And some people don't have access to it, thus answering the questions as they've been received.
Right, which is why it's important to also acknowledge the numerous emails that were received during the week as part of providing information to the citizens of Dover that we received.
Bob, question, comments?
So I sort of slightly disagree with Robin. And I mean, the point of this meeting, at least as far as I was concerned, was to have the boards of health, the Board of Health and us respond to what I see as a fair amount of interest in this mask/mandate issue. And we as a board have consistently agreed that we want to be engaging with and informing citizens. So this is a very important issue. People are very passionate about it. And I think this is a perfect way to augment what other communication vehicles have. Going to, BOH meetings are not necessarily the easiest thing to attend. And by providing information in multiple venues, I think is in the best interests of the community overall. I have some issues not issues. I have some questions with Kay about data, but it's much more about helping people understand risk. I sent Kay an article that was in the New York Times last week, I think it was, and it was the first time I had seen COVID data that separated the impact of COVID on unvaccinated versus vaccinated individuals, and it was pretty remarkable, really. And I think, and I'm going to do this off the top of my head, so people want to research it. It was last week's New York Times. Unvaccinated people run a 12 times greater possible probability of contracting COVID, and if they contract COVID, they are hospitalized at higher rates and dying at higher rates. So vaccinations is clearly a very, very important thing. It has a dramatic impact on contagion. The thing that was very surprising to me, there were two other things that were mentioned. One was the breakthrough phenomena. And I think the breakthrough phenomena is somewhere around there's a 10% chance, 10% probability if you're exposed. But the more startling thing, and this has been a theme in a number of the emails that I've seen, is that if you are over 65, fully vaccinated over 65, okay, you're going to have to help me out here. If you're fully vaccinated over 65 or have immunological issues, you're still at risk. It's still a very high risk group. So people over 65 or those with immunocompromised have to be incredibly careful and cautious about what they do. And what I was trying to get at, Kay, is one of the things that I thought was incredibly effective in the early days of COVID, the 2020 days, was the consistent advice that the Board of Health was providing to the community via the website. And I would really like, happy to discuss at some other time, that we update the information that we provide to the residents through the website to reflect these distinguishes, so that people in different categories, age groups or health situations, have a much clearer idea of risk and how to mitigate risk. So I have one other question I have an issue for Chris Dwelly. Chris, I've seen in the chat box a number of comments about people who are on text, who are texting, should they identify themselves. Can you just quickly inform us of the protocol about how we should be handling commentary from the resident group, please?
So the board can read into the record any question or comment that they are provided in advance, typically during the meeting. And typically that individual would provide their name and contact information. Just a reminder to folks that it is not any member of the public, any and all members of the public are available to attend any public meeting without having to identify themselves. But the chairs usually set up protocol where if somebody wants to make a comment, they ask for their name and typically their location or their residence.
Thank you. Okay, did I get any of that right?
I thought you did a remarkable job of remembering those ratios from that New York Times piece. I found that helpful as well, Bob. And it is sobering to think, but it's also important. I mean, you can look at it as a glass half empty and half full. I mean, the vaccines make a remarkable difference in reducing the risk. But you're right, the risk is still significantly greater for people over 65. Maybe we should put a link to that article on the COVID webpage. It's really very interesting. And it's also important, particularly in times of high transmission, to realize that though people who are vaccinated have a much lower risk of becoming infected, with Delta, that reduction in risk isn't as great as it used to be. And it is quite possible for vaccinated people to have asymptomatic or very minimally symptomatic infections that they can then spread to other people who may not be vaccinated. It's very important to remember that. So people who are vaccinated who develop COVID infections can have viral loads that are as high as the unvaccinated. It's possible that they aren't infectious for as many days, but the latest I've read suggests we don't know that for sure yet. I think you'll find this interesting. I talked to Alyssa Kaiser this week. She's our public health nurse, and she did a little special tally for us. She does not prepare this data for us every week, but she looked at the last 14 cases that we've had. And of those, 8 were vaccinated and 6 were unvaccinated. So I would say we still have a significant portion of cases in each category in our town, even though our vaccination rates are extremely high. And those unvaccinated cases, I don't know how many of them were little kids who couldn't possibly be vaccinated, but it couldn't have been many of them, because of those 14 cases, only about 4 were under the age of 18. So we certainly have vulnerable unvaccinated people in our town, and we still have breakthrough cases happening.
Okay, the way I think about it is even I just got my booster shot, this week. Even vaccinated, you can't go back to 2019, right? You've got to be more careful than that.
Yeah, at least for now. Yeah, let's hope things get better in the future.
So there's a great article if people want to read it in the journal. I think it was about a week ago, or maybe a little over a week ago, about Portugal and how the Portuguese, everybody wears a mask. They all go to soccer games. They're increasing their vaccination rate. But what they have done is opened up the country, opened up the economy. So people are feeling really better about themselves. They're figuring out how to live with COVID. And, a lot of it is wearing masks, because vaccines are just not as readily available in Europe as they are in the US. So, I thought that was a great article that is really the glass half full, living with COVID and, figuring out how to do it and still do the things you love.
In Portugal, that would include a really nice glass of wine.
And they take their masks off to drink the wine, but.
Yeah, it's true that masks aren't effective when they're wet. So you have to do that.
Okay, is there anything else you'd like to add, or would you also like some time for Jerry or for Steve?
I think I'm done with what I have to say. Jerry, do you have anything to add? I'm not sure Steve's here, but Jerry, do you want to add anything?
Well, in regard to the mask, perhaps people will remember that every year when we've had seasonal influenza, we've had nationwide death rates that could peak at 70,000, which is for that disease quite considerable. And this past year, when everyone was either sequestering themselves or wearing masks or both, remember that influenza is yet another virus, just like COVID. And with masking, the influenza rate dropped precipitously, thankfully. Now, can we attribute a causal effect people wore masks, influenza dropped. Well, I suppose some people will argue against it, but it seems to me a reasonable conclusion to support the argument of masking. And as to the difficulty, Robert, that you've raised, that even if one is vaccinated, and of course, one of the difficulties here is we have to look at other factors, age, gender, other prior health conditions that may be underlying. The problem is, if you took an SAT, I think you all remember the infamous normal curve, the bell-shaped curve. And if you remember, the curve going to the left and to the right never quite touches the axis. There's always more than a zero probability of an unlikely event. And John Jeffries certainly remembers this from 2000, when the so-called black swan effect occurred, and something that no one believed could ever happen, happened. So the difficulty in attempting to consider vaccines as perfect is that they ain't. The polio vaccine is probably as close to one currently, and the smallpox vaccine earlier, and that's very much a factor of the immense effort that was made to get everyone vaccinated, so that there was very little possibility. So to argue that the vaccines are not effective because someone got illness is really ignoring the nature of statistics, the nature of the science, and choosing to come up with something that is different from what we really should consider.
Thank you, Jerry. So I'm trying to monitor the chat just to go back to the procedural frame that we discussed at the very beginning. And let me just make this comment that with regards to the Board of Selectmen's process and procedure, we routinely will look at questions that are sent to us in advance during the meeting. We will try to answer those questions, and in cases where we have taken open comment about whether it was COVID related, water related, E. coli related, numerous cases that we've had just recently of public meetings, we always will take comment from people in advance in the time of the meeting, try to, for the sake of time, in the sake of getting questions to the person who's presenting in a timely fashion, we will try to edit, collate, and if when possible, condense questions by many people on the same topic in real time. So again, we have a long history of doing this. I'd be happy to have that conversation with anyone in the chat room on a personal basis, or if you'd like to come into the office, happy to do that. That's our practice. That's what we will do. We are always consistent in that regard. So Kate, as you're going through the chat, do you see there's a lot of comments, but I don't see a lot of questions? Have you been able to determine if there are any specific questions for the Board of Health?
John, yeah, I think most of the comments are about the process tonight. So I think maybe the most effective way would just be to ask, people to raise their hand if they have a specific question.
Jerry,
That's okay with you?
Well, I do want to make something clear, because something was said by Bob Springett that the Board of Health meetings are, quote, difficult to attend. I'm not sure the basis for that. They are mostly scheduled in the morning, although there have been
the timing, Jerry. Not everybody's available in the morning. So
and also in the evening. This past Monday night, we had a meeting attended by over 45 people. I won't attempt to address what the percentage of people on one side versus the other side of various arguments were, but I must say for myself, I was very happy with the way the meeting was conducted, with the people who attended. And I think everyone had an opportunity to voice their opinion, whether in camera, by mic, or by chat. So I really have to differ with you when you say they are difficult to attend. There's another meeting on Wednesday, the 10th, in the evening. We try to cover the base, Robert. We don't
So Jerry,
go on.
I mean, I got your point, right? My comment was, the more we communicate to the public in various ways, the better off we are. You know, we talk about trying to reach everybody. If you got, and a lot of your meetings are in the morning, you do have them at night, you have a very full agenda on your meetings. And so us doing this with you provides an additional opportunity to sort of make sure that the community gets to hear about the issue. That's all. It's nothing, no big deal.
I agree completely with your latter statements. I have no difficulty with the fact that we are discussing this evening. I'm very appreciative of it. I was only concerned about your suggesting that the Board of Health made it difficult for citizens to attend our meetings or participate.
I'm done.
Thank you. Jerry, thank you very much. Dr. Peterson, Professor Clark, Steve, thank you. We recognize this is a lot of work. We recognize the time, the energy, the effort that you put into this, and we appreciate it. What I will leave everyone with this evening is the reason for the discussion, the reason for the questions, the reason for your presence here this evening is because it's important. People have asked us for it, and we are providing, as you are providing, to as many people as you can, what you believe is in the best interest of your town. We're on the same page. We believe that you have the best interest of the town at heart and in mind. That's the end of my comments this evening in this. I thank everyone for their attention, and I will just leave you with, we appreciate everyone's attention to this matter. We're going to move on to the next topic.
Actually, the last two comments in the chat room said exactly that. Thank you to the Board of Health.
I'm sorry, Robin, I didn't hear exactly what you said. Could you repeat it?
I said the last two comments in the chat room that just came up echoed your remarks.
Oh, well, thank you for repeating that. So we're going to move on to the next item, which is the Recycling Committee updates presentation. Carol, are you ready?
Actually, this is Jen Luthi, and I'm going to be starting our conversation off, if that's all right. I'm the new chair of the Recycling Committee, so.
Jen, I apologize, and I should have announced you as the new chair.
That's okay.
You attended your first meeting and instantly was voted chair of the recycling.
I think it's probably a new record, right? I was certainly not expecting it. That's for sure.
No. You just got the Carol Lisbon effect too. Welcome.
Yes, I've told people she does a nice job of twisting arms when you're not really realizing that she's twisting arms.
Yeah, that's going to be turned into a verb. But thank you.
The Lisbon twist.
Lisbon twist. Yeah. Thank you for doing this. Without further ado.
All right. Well, thank you for having us and inviting us to discuss the Recycling Committee's thoughts on the need for additional staffing at the transfer station. And I guess I want to start off by saying that we do understand that the capital budgets are in progress right now, and that Dover is looking to hire a new DPW manager, and that any budgeting or hiring of additional staff for the transfer station will likely not happen before that new manager is in place. That said, we've been discussing this as a committee for some time before I got involved with the committee as well, and we'd really like to go ahead and get our recommendations out there as the budgets are being considered. And we would, of course, be willing to discuss again once the new manager has been hired. So without unless anyone has any questions on that, I can kind of get into the slide and what we're proposing.
I have no questions. Bob, Robin, do you have questions on that part?
No, I'm glad we're starting this conversation. And thank you to all of you for coming, and we look forward to listening to your presentation.
I'm good,
Thank
John,
you.
as well.
Jen,
Thank you,
go
Bob.
ahead.
All right, Kate Yoke, thank you. You beat me to it. So Kate's got our slide, and again, we've been here for a while, so I'm going to attempt to keep this somewhat short and sweet so you guys can move on. You know, as far as the staffing levels at the transfer station have not increased in many years, even as we've added recycling options. So we now have the New Life furniture trailer, we have food scraps, we have food scraps, furniture collection, the mattress container, which I understand may also involve need more monitoring if we need to look at locking that on occasion. The deposit trailer now, where it used to be handled by volunteer groups who would reap the financial reward, is now being handled by the folks at the transfer station, making more work for them to try and collect everything together, also bringing in about $14,000 worth of revenue into the town now. We think, you know, monitoring, we, you know, need to make sure that Dover residents are coming into the transfer station and that folks have a sticker on their car. There are people putting trash and recycling where they shouldn't be putting trash and recycling. Signage that we've had up has historically not worked. People will see a sign, they'll see a full bin, they'll see instructions, and they still will drop the box of books off next to the container in the pouring rain. You know, monitoring of the disposal of the fee-based construction and debris material. You know, we really don't seem to have the manpower to keep an eye on that. So those pieces have really increased the workload of the attendants at the transfer station. And then we also now have the swap shop being rebuilt, which I think most citizens are very excited about coming back. But we do feel that it needs at least some part-time supervision to keep it from becoming the mess that we've all seen it become in the past. It's been very difficult to get volunteers you know, we've put out word on social media, and we're just having no luck getting anyone who wants to volunteer for that, you know, exciting position. And I think, as I read somewhere before, you know, town operations should not be dependent upon volunteers for basic functions. So in light of that, and again, you know, open to any questions you have, we do feel that the two current transfer attendants, Wade and John, are overextended, and we recommend increasing the number of attendants to 3 over the 2. And that's my spiel.
Great, thanks, Jen. Bobby or Carol, would you like to comment before the Board of Selectmen ask questions or make comments? So Bobby Tosi or Carol Lisbon, would you like to add anything to this evening?
I think we have, I have nothing to add to what Jen said. I think we have other members of the recycling committee on as well. I think Janet Greenwood and Wendy Mullers might be on. A couple people left because the 10 minutes allotted to the Board of Health clearly went longer, so they signed off. Who put 10 minutes on for the Board of Health? But if there are any other members of the recycling committee who would like to respond to John's question, please feel free. I see Bobby's here as well. I guess I would just say something I mentioned at the meeting where you had the meeting to get us on to this meeting, that we would not have done this without passing this through to Bobby. And, you know, as Jen said, we all recognize, and Bobby obviously does too, that without DPW leadership here, the operating budget may not reflect what a new DPW director would like to see. But that being said, there was total support for the need for additional attendant at the transfer station. Our concern is that we've been having a staffing discussion for a couple of years, and we missed out on making any kind of presentation in the fiscal year 22 budget, at this time last year. So we want to thank you for allowing us to make this pitch now, because with or without leadership, the need is still there. And I'd hate to see another fiscal year go by without addressing this appropriately, just because there's no DPW director who happened to be on board by the time the operating budgets got approved in February, March.
I'd like to comment. I think that everybody here knows all the work that Wade does. In particular, John is brand new. And I think that when you watch what happens, when those of us on the committee see the number of cars that come without stickers, that have to be asked if they have residents, it's impossible for two people to keep up with this. And just today at the Board of Health, they talked about the concern they have about the mattress trailer, and that people are taking mattresses out of it, which is not permitted. The only way that could be rectified is by locking that trailer, and that requires yet another agenda item for the two people who work there. They spend all day monitoring who is dropping off construction materials, and all of those things actually add to our coffers, because those are items for which people have to pay. And we miss a lot of it because it just is impossible to track.
Thank you, Janet. Jerry, you have your hand raised. Would you like to add something?
What some folks may not recognize is that the strange animal of Massachusetts law puts the transfer station actually initially under the Board of Health. Not that we want it, but it sits there. And we do look at it. And I have to absolutely applaud the staff over the years. Without question, Wade is constantly at work trying to cover things, as are the other staff. Bobby does. Given the limited staff available, I don't think we could see a better job. But as was mentioned this morning and just now, we run into these issues that, for example, state law says you cannot reuse a mattress. So if we're going to accept mattresses and divert them from going into the weighted trash that we pay for, we have to have a mechanism to ensure that we're doing it in a lawful manner, which we're not. Janet mentioned the fact, and I'm there fairly frequently just watching, as other towns have become more rigorous in how they allow residents or even non-residents to approach their transfer stations, as more and more go to pay by throw or increase their fees, the truth of the matter is we've no mechanism to ensure that those people who are dumping trash at Dover are in fact Dover residents. We can try and spot the stickers, but you can't do a good job of it when you're working on two other matters at the same time. So I am fully, and if Steve Kruskal were here, he would be even louder in support of adding staff to the transfer station, not because they aren't doing a great job, but they could do an even better job with more staff.
Thank you, Jerry. Robin, questions, comments?
No, I think this is a conversation that we need to have. And so I'm interested just to understand what the process would be. Bobby, if you wanted to talk about what you see right now, are some of the biggest challenges that you face at the transfer station, and whether an additional headcount would help alleviate those issues. And then, you know, maybe we don't make, as a matter of fact, I know we can't make any decisions tonight. We don't have enough time, but we should, you know, continue to have the conversation with the town administrator and figure out if we all decide that, you know, it is our recommendation to move forward with an extra FTE, what's the best way for us to present that at town meeting? You know, certainly you can't deny that the transfer station is run extremely well. Every time I go there, there are new items that we can recycle. I think the furniture recycling is a great addition. I know many people will be thrilled to hear that the swap shop is opening up again. But, you know, with the swap shop comes additional work as well, because I know, you know, I've seen people just go there and dump a box, and you really want them to open the box and tell you what's in the box, because some of the stuff should be thrown out, and they should throw it out, not the staff at the transfer station. So, you know, so I know with there is going to be added work with the swap shop, as excited as we are to have it open again in town.
Right. Well, coming from my standpoint, the transfer station is definitely a very busy facility up there. No question. Wade and John do a fantastic job. They are extremely busy up there. There's a lot to do. There's a lot going on. In the real world, could they use more help? Sure, you could. As with all the other departments in the town also, the highway is understaffed, the park and rec's understaffed, the cemetery department, he works by himself. Yes, we're all understaffed. I think with this new director coming on board that the town of Dover is looking to hire, in many discussions with Chris, we were going to basically leave this decision up to him and how he wants to move forward with hiring personnel. And the transfer station, you know, obviously was being one of them. But at this time, with the two people we have there, they do a fantastic job. The work gets done. And right now, I can't see filling a position at this time. That's my personal opinion. But moving forward with a new director, you might want to revisit it. That's just my suggestion. We are able to keep up with the two people that we have there now.
May I?
Sure.
John?
I'm sorry.
Yeah. May I? One of the reasons that the transfer station continues to be in the condition that it is, which I think is an excellent condition, is not only because of Wade and John, it's because of the hours and hours and hours that the recycling committee members spend at the transfer station every week helping out John and Wade. And if we were not to be there, I think, with all due respect, Bobby, you approved this memo when we sent it out. So I don't know what's changed here, but with all due respect, if the recycling committee chose not to spend hours and hours going through, I mean, we have pictures of Wendy going through the yard waste, picking out plastic and styrofoam that people have thrown in the yard waste. We have pictures of Wendy opening up the trailer for the textiles and going in that disgustingly large trailer, moving around bags away from the opening so that more stuff can be put in. You know, we have pictures of all of us moving furniture from the top to the bottom and the bottom to the top. So yes, the transfer station and its current condition is due to two incredibly hardworking employees and 5 or 6 recycling committee members that spend hours every week helping out. And once the swap shop opens, it's going to get even worse. When the swap shop was open, we'd have boxes that we would open up. We'd find dead mice at the bottom of them. I mean, it was disgusting and was so unorganized that every week when it got too chaotic, they would just come in, take everything off the shelves, throw it into trash, pay the tipping fee, and start all over again. That's not what a swap shop is all about. And if we open this swap shop in November or December, that's exactly what's going to happen again.
Bob Springett, you want to add comments, questions?
I think Carol just made a great point for why we've been pursuing a strategy of hiring professionals to review town operations and make recommendations from an overview perspective, and then acting on those recommendations. I think that's worked in the finance area and other areas. So I think that I think we need fresh eyes to look at this operation in conjunction with the rest of the responsibilities of the highway department. That's why you hire somebody to do it. So I hear what everybody said. I agree with what everybody said. But I think the right managerial steps to do is to hire a director of Department of Public Works, look at the entire operation, and based on their professional experience, make recommendations of how we should move forward.
Is it your expectation that that timeline means that the fiscal year 23 budget for the highway department will take into account this new professional that you are hiring? Or what's the timeline for hiring him or her?
Chris, could you give us an update, please?
Sure. I was going to give this during the town administrator updates, but I'll jump to it right now. The DPW director recruitment closes on 11/19. So we're hopeful to have a director in place at the turn of the calendar year. And the budget season is the process is a long process. So there's still a lot of time where we can have conversations. I'm certainly happy to sit down with both Bobby and the recycling committee to talk about other potential opportunities for lightweight support staffing with the swap shop and other ways as we take a more holistic view of the transfer station operation.
Just thinking and speaking out loud, which usually gets me into trouble, but maybe I was just thinking maybe there is an opportunity in the short term. I know there's the senior tax payoff program.
We tried that.
It didn't work. Okay.
The swap shop requires lifting boxes, moving books, and that kind of stuff. So Janet had said she'd be willing to, publicize it, but she didn't think that given the nature of the job, that there would be that it would be effective to find somebody.
It's also it's my understanding that there are only 4 or 5 people who are doing the tax write-off request. So it doesn't give us enough people, and every other town is run by volunteers, and they have a lot of them. We have put out every social media request we could possibly put out for volunteers just for 2 hours once a month for the New Life Furniture Bank. We aren't getting anybody. I've gone to the Boy Scouts, Eagle Scouts, the churches, the American Legion. Nobody is volunteering, and nobody will volunteer.
Thank you, Janet. So, Robin, do you have anything that you'd like to add to that?
No, I told you thinking outside of the box usually is dangerous, but I think it sounds, we all know, because we all go to the transfer station, that there's a lot of work that gets done, and I don't think we should shut the door on thinking about whether or not it makes sense to have another FTE. It really is a part-time FTE, actually, because of when the transfer station is open. So I would just like to make sure that we take Chris up on his offer, and we continue to talk about it and look and continue to document, the difficulty to get people to volunteer, and and see how things progress as we go through the next few months.
Okay. Thank you, Robin. Jen, I'll give you the last word. Anything you'd like to add to this? You're muted. Jen, you're muted.
There we go. Found it. I actually do not. I think Carol and Janet did a very succinct job of filling in the spaces that I left when I said my piece at the beginning. So I agree. I think we should, Chris, we will take you up on your offer to sit down and talk to you about our thoughts and your thoughts, and that'll be a good place to go forward.
I just might add that we have our monthly
Yep.
meeting on Wednesday evening, November 10th. If you guys would like to participate, Jen could certainly add it to the agenda. It would be a great discussion.
Thank you, Carol. That's a great idea.
Thank you, Jen. Thank you, Carol, Janet, Bobby. Thank you all very much. As we said, earlier with our first item, we really appreciate the work you do. This is a lot of hard work. It's a lot of dedicated hours. I can only echo everybody's comments by saying, as a resident, I'm amazed at how many things get done there, and by so few people. I know that it's an ongoing conversation within a small town where things are typically done by volunteers. So thank you for your hard work. Thank you for all the hours that you put in. We're going to move on to the next item, which is a discussion of Chapter 61A in our state agricultural land potential, or a right of first refusal at 130 Farm Street. Chris, would you like to speak to the opening of this?
Sure, John, happy to, thanks. So back in September, the town received notice of 130 Farm Street and the intent to sell lots 1, 3, and 5. It was chapter land, so that triggered the town's opportunity for right of first refusal. That then triggered the town's process, or the Board of Selectmen's process, rather, where they then poll many of the boards and committees, land use related committees in town, to get their perspective on whether or not this might be a property that the town might be interested in purchasing or exercising its right. We did hear back from the Planning Board, the Conservation Commission, the Open Space Committee, and the Board of Health, all who recommended that the town does not exercise its right and let it continue on with a private sale.
Thanks, Chris. I can just reiterate what we discussed at our last meeting, that at our open space meeting last night, we're still unanimously in favor of the town not exercising its right of first refusal. Robin, Bob, do you have anything you'd like to comment or add to this?
So, John, no, I think this is sort of ready to go.
Okay, I'm going to move not to exercise. I move not to exercise or assign the town's statutory option to purchase pursuant to Massachusetts General Law, Chapter 61A, Parcel 15-270, 130 Farm Street, Parcel 1527A, Lot Number 3, Parcel 1527B, Lot Number 5, Parcel 1527C, Lot Number 1, on the Dover Assessor's map.
I'll second that.
Seconded by Robin. All in favor? I, John Jeffries.
I, Robin Hunter.
Hi, Bob Springer.
Thank you, everyone. Chris, we're going to move to our next item of business. The West Suburban Health Group disclosure of financial interest and potential vote. And Chris, would you like to frame this?
I would, yeah, thanks, John. So the town's treasurer, Jerry Lane, and I serve on the board of the West Suburban Health Group. That is an entity made up of a group of communities in which we purchase health insurance for our staff members. Jerry and I, as board members, have a financial interest in our role as board members, given that we vote on the rates that ultimately we then purchase health insurance from. And so the state requires us to file a disclosure that we have a financial interest in those activities with the town. So this is a form that goes before the board. It's gone before you, I think, the past 2 years for your recognition and approval.
Any comment, Bob or Robin?
No, good to go.
Thank you. So the motion, I move to approve pursuant to Mass General Law, Chapter 26(8)A, Section 19B, the exemption of Jerry Lane and Chris Dwelly, interest in serving on the Board of Directors and or Steering Committee of the West Suburban Health Group, as their interests are not so substantial as to be determined likely to affect the integrity of the service which the municipality may expect from the employees. Ask for a second.
Second.
Second by Robin. All in favor? I, John Jeffries.
I, Robin Hunter.
Hi, Bob Springer.
Thank you. So moved. The disclosure and the disclosures will be signed by us. I'm sure Mona will have them ready for us tomorrow. I'm going to move to item number 5, the appointment of Courtney Starling as Dover's representative to the Metropolitan Area Planning Council. And in summary, Chris, I'll just read the summary and save you a few words because you've been pretty active these past 2. Land Use Director Courtney Starling will be assuming Mr. Dwelly's position as Dover's representative to the Metropolitan Area Planning Council. Is Courtney present so she can speak now or forever hold her peace?
John.
She's not.
John, first mistake. Just nominate her.
I was just, even
way
before the
too
firing,
nice. You're way too nice.
before the firing squad, don't you usually get your last words, right? Oh, that's a joke. I'm just kidding. Suggest that my motion is, in accordance with the provisions of the Massachusetts General Law, Chapter 40B, Section 24I, move to appoint Land Use Director Courtney Starling to the Metropolitan Area Planning Council for a 3-year term effective November 4th, 2021 and ending November 3rd, 2024. Ask for a second.
Second.
Robin seconded. All in favor? I, John Jeffries.
I, Robin Hunter.
Hi, Bob Springer.
Courtney, congratulations. We're so proud of you.
Are you sure?
Teacher to not come to one of our meetings.
Yeah, I'm not sure about that. Yeah.
Oh my. So yeah, exactly, Robin. Teach her to take a meeting off. She does this again next week. She may end up with another job. In addition to the ones she already had.
Notice how quiet Chris is.
Yeah. So Selectmen updates. As I mentioned from open space, very lively meeting of our open space. Lots of lively discussion led by Justine about the death of our Christmas tree. And Justine really, really wanted to figure out where we were going to replace our Christmas tree at open space. So I I suggested that we may take one of her 36 pine trees on her property, but I don't think that that's a viable solution. So there were no real burning issues at open space, and things are progressing nicely. We did have a lengthy discussion regarding the communication tower up on Snows Hill, and I promised to get them through the chief an update. So we'll let them know how that is progressing. Chris, I know that we're going to have a comment from you in your portion of the cell tower, where the cell tower stands. I'll leave that for you. Robin, anything that you would like to report?
I have been neglectful of my duties as Board of Selectmen the last 2 weeks, so I do not have anything new to report.
Bob?
First, John, you need to write that down. That's good. That's worth a couple of drinks, don't you think?
I think so. At least a couple.
So I have, on November 8th, I think it's Monday, the building committee is going to review, quote, the final design of the Carroll Community Center. This has been a little bit of an arduous process. There's been a couple of presentations made, and people have been encouraging the architects in particular to present something that's a little closer to the things that were presented in 2021 in various and sundry places around the town. So I would encourage John and Robin, you guys might want to show up via Zoom at that meeting, just to make sure that as representatives of the town, we're consistent from June of 2021 through today. So other than that, that particular project seems to be moving along according to the timeline. Otherwise, things are pretty quiet.
I'll add to that.
But I'm not going to talk about that.
Thank you, Bob. I will make that a priority and be in attendance via Zoom. I just want to also mention along those lines that I've had many conversations with Courtney Starling regarding the simultaneous vision of the village center visioning. I don't know if that's the exact
town center.
Town center.
We are not a village. Town center.
Town center. I think it was Chris that might have put the village in there, or maybe it was Courtney.
It was Chris.
No, John, it takes a village. It takes a village to build a town center. I can see the confusion.
I'm losing it now. We were so good for so long.
I know. I'm going to go with that. The town center vision. And I really think that, Bob, that there's a lot of, that at this point in time with Carroll, with a lot of the interest, with the enthusiasm, with a lot of the time and attention that people are putting into this, that it's a really important thing that Courtney synthesized a lot of the things that we're doing with Carroll with regards to the center project. So I think it's just a great time. It's a very important thing. It's also a very important thing to get feedback from all of our business owners and the people who are patronizing our businesses as to how these things can integrate into this project. So I applaud everyone's efforts along these lines. Chris, I think you have our updates. Can we move to your updates?
That is your call, Mr. Chairman.
I would like to move to your updates.
All right. To start, our first town newsletter, Our Town, has gone out. I just want to give a big thanks to Ruth Townsend and Kate O'Brien for making that happen. They both did a tremendous amount of work in terms of reaching out to people, collecting information, and then putting that into what I think is a pretty easily digestible and really good looking document. So just want to remind everybody that our intent is to hopefully be able to provide something every month, and that it will be posted to our website and on our socials. So just another plug for people to sign up for the town's newsletter automatic update, so you get that right into your inbox without having to look for it. Our telecommunication lease process, as the board knows, we went out to bid to renew the telecom providers. on the cell tower behind the highway garage. We had a very successful bid process, which wrapped up last week. All of the existing carriers submitted a bid within the town's proposed financial threshold, which is really great. So the staff are now just in the process with our consultant in wrapping up the lease documents and the other paperwork related to the process with the carriers. And then we'll bring that to the Board of Selectmen for a final vote of approval. But I just wanted to share an update, and also good news that, you know, sometimes these are pretty lengthy and can be precarious processes, but we're happy to see the response that we received. On solar, we finalized a good deal for the town for the roof array over at the highway garage. We've got a proposed pilot that we'll be presenting to the Board of Assessors on Monday for their review and approval. Once we receive that, we'll be able to package up all the documents related to this project and have that scheduled to go before the board when you meet next November 8th. So that project, at least from a process standpoint and presenting it to the board, is nearing completion. We talked a little bit about recruitment earlier, at least as it relates to the DPW director. Again, just wanted to remind you that the recruitment for the director is out and it closes on 11/19. So we're eager to see the applicant pool that we get from that. We've also got the project manager, which is a repurposed, which is a position that is a repurposed position of one that was existing in town. That closes on 11/12. Also looking forward to see the candidate pool that we get for that position. John, you mentioned Snows Hill. Sounded like you asked for an update. So I just, after the board's approval 2 weeks ago for me to pursue ARPA funds to pay for the long-term replacement of the police radio system, I've submitted all that documentation in conjunction with Chief McGowan this week, and we're now just waiting for approval from Norfolk County on the project and for them to release the ARPA funds to us. Anticipating a successful, anticipating approval of our request, we'll then be able to move forward with getting a longer-term radio system in place, and we'll then be able to take down the temporary tower on top of Snows Hill. And then lastly, two things I just wanted to preview for the board. I sent you an email on this matter, and there was another email that was sent from the state. The first is that I just wanted to let you know that the town has fulfilled its reporting requirements to Mass DEP as it relates to the new PFAS testing requirements. The town's responsible for the Carroll Park well. We were fortunate and happy to see that the well tested well below the 20 parts per trillion, which is the state requirement, came in between 3 and 4. I will have Carl Warnick come before you at an upcoming board meeting to be able to discuss those results, what they mean, and what the process looks like moving forward. But I will say at this time, this is really great news. There's a lot of communities out there who are testing well above the threshold and are now scrambling to look for new water sources. And then secondarily related to PFAS, the state has been also heavily recommending private well owners test their private wells for PFAS. They did a campaign in Dover, and they reached out seeing if we could continue to communicate that the program is open and available to people. So I wanted to share that. There's quite a large group of folks that are on that email, including members of the Board of Health. So I just wanted to share that opportunity is still out there for people, and I'm sure we can leverage the website and social media and other avenues to be able to share the message that it is open and available. And that is all I have for the board this evening. Thanks, John.
Thank you, Chris. I just want to make two comments real quick, Chris. One is regarding the cell tower and the other is regarding the radio tower. Just for people who are listening at home or watch this when it's, as we're recording it. With regards to the cell tower, about 4 years ago, the Board of Selectmen continued the process of, in our strategy of negotiating the space and the reimbursement on the cell tower, we have hired a consultant. We continue that process. We hired the consultant. It was the consultant's recommendation to us probably more than a year and a half ago, that we go through this process that Chris is referring to, because not to bore everybody with details, but you're offered a rate and then you go back. There's a negotiation process with the rate. We, the Board of Selectmen, decided to take the longer, a little bit more strategic path. And as Chris just mentioned, that path has actually led to a very successful reimbursement rate that would have been better than the rate that was being offered. So that's the summary of that process for those that are watching at home. The other item is the cell tower. That's the temporary tower on Snow Hill, is a communication tower specifically for our emergency preparedness and emergency response. And that tower that is temporary takes the physical presence of two very, very large vehicles. The one that is taking the place of is attached to the Ranger Tower at the top of Snow Hill. The temporary vehicles will go away. The permanent structure will remain. Again, just for those in summary that are interested in what we're referring to in these two items. That is it for me. Robin, questions, comments for Chris?
Oh, thanks for the update.
Bob?
No, pretty complete. I was trying to figure out when we're going to have Dave Sullivan tell us what he's been up to, but it looks like it's not going to be till December. So you're going to have to use a little powder on your beard to make sure that when you make the appearance, you're representing the season.
Can do that. Starting
That's a challenge,
already.
David, that's a challenge.
Look, it's easy. It's easy.
Dave, personally, I just think Bob's jealous that you're
I was going to say the exact same thing.
Oh, be that way.
We're going to move to the consent agenda. If everyone is, are we good on everything on your end, Chris? Let's move to the consent agenda. The renewal of the annual package store, the Dover Wine Company, and our club liquor licenses, which are the Dover Legion, the George B. Preston Post 209 American Legion. Approve the 2021 special liquor licenses for September 27th, October 29th, November 3rd, retroactively, November 6th, and to approve September 23rd and October 7th open session meeting minutes. I move to approve the consent agenda as presented, asking for a second.
Second.
By Robin. All in favor? I, John Jeffries.
I, Robin Hunter.
Hi, Bob Springer.
So, Bob, you can go in tomorrow and be the first one to sign Dover Wine's liquor license. Make it really, really big, so when everybody walks in, then they can see Bob Springer right on top. Without you, we'd have no wine.
I think I'll stop at the store first and see what I can pick up.
What time do they open?
I don't know, but it's certainly worth my time.
Yes, it is. Any other matters this evening?
Well, I think we had a lot of people, and I think we had a pretty good meeting, and I hope people, there was an awful lot of good information that we shared with the public. I thought Board of Health did a really good job. I thought that Recycling Committee did a really good job. And it keeps our residents knowing that aside from you, John, Robin and I are hard at work.
Right, and the timing of the presentation couldn't be better. Look at the good news they had to report. The Board of Health.
Yeah.
That chart, I literally I got the chart about 6:15, And that number went way down. It was really a shock, and it's a very good surprise. Very happy to see it. I think Kay, just scribbled the other numbers out, just had it come down just for her night tonight. Hello, Kay.
Can I just lay a little crepe though? I mean, I just want to, we can't get too far out ahead of this because, it may not, it may be a trend, but we may not be there yet. But so don't get your hopes up. It's too late, I know.
Yeah, but Kay, we know this thing's been surprising, and you really got to be cautious. There's no question about it.
Yeah.
Right, and there's that new strain, I can't think of the name, that they first found in Colombia, that there's been some cases in Massachusetts and a few other states.
But Kay, you have to celebrate the good news too, huh?
Absolutely.
Right.
Drink red wine through your mask, Bob. Go ahead.
It won't
I have a
work
special
well.
mask, it has a slit around here, so I just go. It's like not a problem.
With a straw.
Quick story before we adjourn. I had a friend, we had a Halloween party. He came as the mummy, and he loves red wine. So we had gauze all over his face. By the end of the night, I think there was more wine in the gauze around his face that he either consumed. It was the funniest thing. At that time I wish I had an iPhone. I could have taken a picture.
Right. I thought you had a Halloween party and didn't invite us. I was getting.
This was in Brooklyn. This is when I was like having fun.
I am asking for a motion to adjourn. I'm making a motion to adjourn this evening and ask for a second.
I will second that.
All in favor, aye, John Jeffries.
Hi, Robin Hunter.
Hi, Bob Springett. Thank you, guys. Have
Thanks,
a wonderful
everyone.
night. For everybody who stayed with us, enjoy the weekend. Weather's going to get a little warmer next week.
Absolutely. Thank you, everyone. Good night.